Okay, so seems like the numbers are steady at the moment, so we might just get started. So thank you everyone for joining us today. It's really exciting to have so many people here and have such an amazing speaker to talk with us today about Hodgkin's lymphoma. So we're also going to be launching today the MyHodgkin MyHealth App launch. And I'm Nicole, the New South Wales Lymphoma Australia care nurse, and I'll be the host for today's session. So I'd like to begin by acknowledging the traditional owners of the land, and I would like to pay my respect to their elders past, present, and emerging. So before we kickstart into it all, there's just a few housekeeping and technical details we just need to cover. So if you have any questions, there will be a chat function on Zoom. So we just love you to put any questions within the chat function in the bottom of the screen. And we will have some time at the end of the presentation today just to answer some of those questions. We will try to, we will endeavour to answer as many as we can, but if we can't get to them, we will definitely answer them, whether it's today or at some point. The chat function will be also monitored. If you miss anything, the webinar is also being recorded and we will send you the link afterwards. And eventually this webinar will be uploaded to YouTube and a link will be sent to you. And if you have any technical issues during the webinar, please just email the nurse email, which is just nurse@lymphoma.org.au. We can just put that in the chat and we'll try and address it for you, as we will have a nurse that will be monitoring that email during the webinar. So we are here today to talk about Hodgkin's lymphoma. So Hodgkin's lymphoma is an aggressive or fast-growing form of lymphoma, and it affects approximately 800 Australians annually. And it can be seen in people of all age groups. However, it is really commonly diagnosed in adolescents, young adults, and even children. So today, we are very luckily joined by Dr. Nicole Wong, and she will be talking to us about Hodgkin's lymphoma and sharing her research in investigating patients' unmet needs. Her research has led to the development of the MyHodgkin MyHealth mobile app, which is designed to assist people with Hodgkin's lymphoma from diagnosis and even years after treatment. Dr. Nicole Wong is a haematologist at Concord Repatriation General Hospital, and she's also the senior lecturer at University of Sydney and the New South Wales Counsellor for the Haematology Society of Australia and New Zealand. She's the director of the Haematology Clinical Research Unit at Concord Hospital, and she's been in that position since 2022. And she leads a team of 20 in the delivery of haematology clinical trials embedded within clinical practice and clinical translation research. And she's also the principal investigator of a number of lymphoma and myeloma trials. So I'm now going to hand over to Nicole. Thank you.
Thank you so much for the lovely introduction, Nicole, and I hope you can hear me okay.
Yeah, we can hear you well.
Fantastic. So what I'll do just to get started is I'm just going to ask you all to check that I'm going to be sharing the right slides. I am going to share with my presenter view, and sometimes that sets things off in an unpredictable way. So just bear with me. Now, would you mind telling me whether you can see my main slide or the presenter view with all the other bits and pieces there?
We can see the presenter view, Nicole.
No worries. I'm just going to switch them around. How is that?
That is still the same view.
That's interesting. Okay. made any improvements, and am I sharing a full screen, or am I still sharing a presenter view type?
It looks like presenter view, but we can still see the screen. Like it's not, we can just see your slides to come as well, just on the side.
Ah,
It's still
okay.
legible.
All right, I am going to keep it like that just because my camera, if I take these extra screens away, I think is not going to work, and so we'll get started like this. So thank you to everyone who's logged on today. I was very excited for the chance to give you all an update on staying well after your treatment with Hodgkin lymphoma, and to also tell you about some very exciting research that we have launched at Concord Hospital that that is a national research project, and it's very much focused towards improving the lives of our Hodgkin lymphoma patients after they've finished their treatment. And so many of you, I know, have already received an email from Lymphoma Australia letting you know about this research project called MyHodgkin MyHealth. And this is research that we hope will support a healthier Hodgkin's community. And we could see already that some of you have already gone to the App Store or the Google Play Store and just started to register to find out what this project is. So if you haven't already, if you're interested in finding more about this, and I'll talk about it at the end, go to either the App Store or the Google Play Store, and you won't commit to anything, but it'll take you to a page with some further information about this research project that you're very welcome to look at while we get started. As a background, as many of you know, Hodgkin lymphoma is not a common lymphoma, not a common cancer. But each year in Australia, about 600 people are diagnosed with Hodgkin lymphoma. And the commonest age groups are those adolescent young adults, and then also our slightly older, over 55-year-olds. And that's demonstrated in the graph there that shows that highest peak occurring in young teenagers and young adults, and then becoming slightly less common and then increasing again in later age. The good news with Hodgkin lymphoma is that about 90% of people with stage 1 to 2 Hodgkin lymphoma remain lymphoma-free after 10 years and are cured, and about 70 to 80% of people with stage 3 to 4 Hodgkin lymphoma are also lymphoma-free in the long term. And the goals of our treatment now, as well as the goals of the treatments that new treatments that we're trying to develop, are to aim to cure the lymphoma while also reducing and minimizing the short and long-term side effects of the treatment. And although those success rates with treating Hodgkin lymphoma are really encouraging, as you can see, there are some still Hodgkin patients who need further treatment where we know we can do better. We also know that...
Can I interrupt? For me, you're suspended on the first slide. Is that happening for anyone else?
Yeah, I was just about to say the same thing, Judith. I don't think we're seeing each slide. So a few people have said in the...
We've had a tip.
We've
You
had
could
some
try
tips.
using,
Yeah.
we have some tips. You could try using the F5 function key to display the full screen, Nicole.
I'm going to share again and see if I can get it started again.
The other alternative, I could share my screen and share your slides if you can't do it, Nicole.
Can you see slides advancing?
No.
Odd. Can you see my screen? Can you see my first slide?
We can see your first slide. Yeah, we've got
Okay.
someone's raised their
Yeah. Mhm. Okay.
Well, if you're happy, Nicole, I can share my screen.
Yeah, why don't we do that?
And then
Well, we'll let everyone in on the secret that we didn't quite complete our test because
Yeah.
we had a few technical
That's okay.
difficulties.
Just give me 1 sec and I'll just have to bring it into PowerPoint.
In the hospitals, we started off using Zoom in COVID, then we were all moved over to Teams, and we found it all really bulky and difficult. But now I think the hospitals are really well set up for Teams, and now we're sometimes having these technical difficulties with Zoom. So thank you for your patience.
Nicole, do you want to keep chatting about the app while Nicole's loading it? Or have you got it, Nicole?
Just about. Just 1 sec. Should be right now. Okay. Can you see that?
Yes.
Yeah, you can see
Great.
it. Okay, I'm going to flick through.
Oh, yeah.
Yeah,
And we'll
that's
see.
going
Yeah,
okay.
yeah,
Yeah,
that is
okay.
going. Yep.
All right.
Fantastic. Okay.
All right.
So the slide that I was aiming to talk to is the next slide, and it was just to say that those cure rates, those really encouraging cure rates, are not necessarily the same as what we see in our older and more frail patients. And that's just an introduction to say that the research in Hodgkin lymphoma to improve treatment is still very active, and there are new drugs and clinical trials. Because we know there are some patients for whom we can still do better. So next slide, please. And still in Australia, current first treatments for Hodgkin lymphoma generally consist of chemotherapy, and for the younger patients, these treatment regimens are probably familiar to you, and they are either the ABVD chemotherapy or a chemotherapy called escalated BIACOP, where, as you know, each letter stands for an chemotherapy agent. And as we get to our older patients, we generally need to drop some or change some of the chemotherapy to reduce the side effects. For many patients that are in stage 1 to 2 lymphoma, they will have some radiotherapy as follow-up after 3 to 4 cycles of chemotherapy. And for people with stage 3 to 4, they may need to have more chemotherapy, and we generally can reserve radiotherapy only if there's still some residual lymphoma at the end of treatment. So if we just go to the next slide. For some people, that is the end of their treatment, and they may be cured after that first treatment option. But for other patients, their lymphoma may return after that first treatment, and they need a second treatment. In that case, it tends to be a change and a switch in type of chemotherapy, followed by an autologous stem cell transplant, where we use your own stem cells to help you recover from the stronger chemotherapy. And in a small number of situations, the second treatment, the Hodgkin lymphoma returns after the second treatment, and another treatment is required. And these two next agents are the targeted treatments. First one is brentuximab, which is an antibody targeted to the outside of the lymphoma cells. And the second is pembrolizumab, which is an immunotherapy that allows your own immune system to target lymphoma. Other treatments after these are uncommonly needed, but stem cell transplants using a donor stem cells are options in a few cases. Next slide. So chemotherapy works by targeting the DNA inside the growing lymphoma cells. It's not specific to targeting lymphoma cells, however, and that's why in the short term, chemotherapy affects all cells that grow rapidly, primarily lymphoma and cancer cells, because they are amongst the most rapidly growing cells, but also the cells that line the mouth and the gut, which leads to some side effects. The hair the follicles, so leading to hair growth, and also blood cells, and that leads to some of the side effects of chemotherapy, like infection risk. Certain chemotherapy medications have particular toxicity to parts of the body, such as heart tissue, which can lead to a heart condition called cardiomyopathy, and to nerve cells that can lead to numbness and tingling in the fingers and toes called neuropathy, and to affect lung tissue, which can lead to a condition called pneumonitis or inflammation in the lungs. In the long term, chemotherapy can damage the DNA inside our normal cells, and it can lead to a greater risk of later cancers. Next slide. Now, radiotherapy, which I talked about, is not used in every person with Hodgkin lymphoma, but can be an important part of treatment. Has evolved a lot over the decades that we've understood that it's an effective treatment in Hodgkin lymphoma. And the way that it's evolved and improved over time is that we now can use the radiation in a much smaller area to treat the lymphoma, and we can use a lower dose of chemotherapy. We measure in grey. We used to use 40 grey of radiation. Now we use doses that are as little as half of that. And that's because of our better understanding through clinical trials and research that tells us that those doses can still be enough to help in the cure of lymphoma. I'll run through some of the side effects of radiotherapy later. Next slide, please. And I wanted to tell you a bit more about brentuximab, this antibody that's one of the targeted treatments for Hodgkin lymphoma. Some of you may have your own experiences with this already. This is an antibody that's been designed to recognise the outside of the lymphoma cells, and it attaches to the outside of the Hodgkin cells, and it carries with it a toxin called vedotin. And that toxin is then released inside the cell and can kill the lymphoma cells. And the toxin's delivered in that targeted way so that it doesn't have quite the same side effects as chemotherapy. And so this is a major advantage in brentuximab, that it still does have some side effects, in particular neuropathy, and it can also, when we use it, lead to low white blood cells and infection risk. But by and large, the side effects are much more mild than chemotherapy. Next slide, please. And the other targeted therapy in Hodgkin lymphoma are what we call are a type of immunotherapy, and the one we have available in Australia is called pembrolizumab or Keytruda, and it unlocks and unleashes your body's healthy T cells, and it allows them to bind and kill tumour cells, and so it promotes the body's immune system to fight the lymphoma, and it can be used alone or in combination with chemotherapy. There can be some side effects, but they're not common. It's more common to have very few side effects from pembrolizumab. It can lead to overactivation of the immune system and inflammation in lungs, liver, or thyroid. But as I said, by and large, it's delivered without us seeing these side effects. Next slide. So for the rest of this talk, I wanted to focus on your health and well-being after finishing either one or more of the treatments that I've just described. And sometimes patients will ask me, well, how am I supposed to feel after finishing Hodgkin treatment? Next slide, please. And there are a number of symptoms that many of you will have experienced and that we recognised. And I think the most common, but in some ways the most difficult to put our finger on, is fatigue. And I think it's tricky for doctors and nurses to put their fingers on this because there are many potential causes for fatigue, from anemia or low red blood cells. Fatigue is a side effect of chemotherapy, immunotherapy, and radiotherapy that generally gets better over time. It could be a side effect of low thyroid function, where the thyroid can be affected by radiation in that area. It can be a side effect of the symptoms of early menopause. It can be a complication after treatment. It could be linked to the mental health and then the ups and downs of the emotional reactions after cancer diagnosis and treatment. Fatigue can be a symptom of heart disease, a subtle symptom of heart disease. For many patients, their worry is the fatigue a symptom of my lymphoma? And this is something that your specialist would assess with you and will ask other medical questions and perhaps order blood tests to help answer that. Next slide. I think another post-chemotherapy symptom can be feeling out of breath after physical activity. And on the left-hand side, we, as doctors, we will often focus on what treatments that you have had that may have affected the heart or the lungs. It's really heart and lung function that tend to lead to that feeling of breathlessness. For the heart, we have a look in your records and evaluate whether you've received a chemotherapy that can affect the heart muscle, and that ingredient is the A in ABVD or the A in escalated Bierkopf. So most patients have received this chemotherapy. Less commonly, you may have received radiotherapy to the heart area. In terms of thinking about your lungs, we look in your records and see if you've received the B or bleomycin within your chemotherapy. But usually it's quite clear to your treating doctor whether you've had any lung issues as a result of this bleomycin, because it tends to be something that becomes quite evident at the time of treatment rather than later on. So the immunotherapies and also radiation can potentially cause issues with the lungs. There are other causes other than heart and lung disorders that can lead you to feeling out of breath. And after considering those, the health of your heart and lungs, your doctor will think about whether breathlessness could be due to a lack of physical fitness after treatment, and may be able to guide you to a gradual return to exercise. And we use an exercise physiologist to help you do that safely. We would assess your heart and lungs in the clinic by taking a history and then performing an examination, and perhaps also ordering some cardiac tests like an ECG or an echocardiogram, and potentially following up with a stress test on a treadmill and a review by a specialist cardiologist. Your lung function, we may well test with lung function tests where you breathe in and out through that breathing machine. And we may look for blood clots in your lungs. So all of these things can be assessed by your specialist. Next page, please. One of the challenging symptoms during and after chemotherapy is neuropathy, the numbness or pain or tingling due to a side effect on the nerves following lymphoma treatment. Our monitoring of your symptoms of neuropathy during your treatment is really important in guiding us to decide whether your chemotherapy needs to be changed or altered because of neuropathy. But we do recognise that after finishing treatment, some of our patients still have numbness or tingling that can be really difficult, particularly at night time when the busyness of the day is settled down and you don't have the distractions around you. We do know that nerves to some degree can improve and recover, but nerve cell recovery is very slow. And so a lot of my patients are still seeing some improvements in their neuropathy 6 and 12 months after their treatment. So I do encourage patients to remain optimistic that there will be some recovery. Some physical use of hands and toes, I think, is an important part of recovery, and our occupational therapists generally will advise you to do some small motor exercises of the hands and feet. But for some people, that neuropathy will be an uncomfortable and painful neuropathy, and in some cases prescription of medication is needed. to treat the painful component. And we have 3 general pain, nerve pain medications that we use and trial. It's important for us to remember that there are other causes of neuropathy, and that we should think about making sure that you have diabetes, that it's well controlled, and that we think about other causes that of disorders that may damage your nerves. I'd say that as we develop newer treatments, we hope we can use less treatments that lead to neuropathy, and substitute them with other effective treatments that leave nerves undamaged, and that's one of the goals of our research. Next page, please. Now, after chemotherapy, and indeed after some radiotherapy, there can certainly be an impact on reproductive hormones. And the first 2 bullet points here are really targeted and relevant to women that have been through chemotherapy. Chemotherapy has the risk of impacting and affecting fertility, but we know from research that some chemotherapies are more potent at reducing fertility than others. And so that discussion around different treatments and their impact on fertility is ideally something that your specialist has discussed with you at the outset and when you're starting treatment for lymphoma. Also, at that time before treatment started, discussions about preserving fertility should begin at that time. For men and their fertility, we have a discussion around collecting and cryopreserving sperm for later use. And for fertility preservation for women, we personally at Concord Hospital get our fertility colleagues to lead that discussion so that they can apply their expert knowledge, and we work in consultation with them. After treatment, the fertility specialists can reassess your fertility. There can be retesting of sperm count and viability, and there can be reassessment of female fertility as well, and then referral for reproductive technologies like IVF and other reproductive technologies. For other patients, it's less about the idea of family planning, and it's more about some of the symptoms of the hormonal side effects. So chemotherapy can trigger early menopause for some women, and also the symptoms associated with menopause. And they can include fatigue and weight gain, hot flushes, mood changes, and difficulty sleeping, and a dryness in the vagina that makes sexual contact difficult and uncomfortable. And often these symptoms are symptoms that our patients aren't sure who they should ask. They're not sure if they should ask their haematologist. They may find that their GP is not sure what to do with advice. And I know that this is an area that is challenging. We refer our patients to a gynecology clinic or an endocrinology clinic, and I found that there is some really useful information online, such as from the Australian Menopause Society, that you can use to take to your GP to have a discussion about the risks and benefits and the pros and cons of hormone replacement therapy. And I think taking some of that information through to your GP who may not be as familiar with early menopause post-chemotherapy can help get you to that next step of being referred to the appropriate specialist. Early menopause can also increase the risk of osteoporosis, and you should be screened for your bone mineral density. And we know that people that have had early menopause should also maintain really good cardiovascular health as well, because there can be an increased risk of cardiovascular disease. And for men, it can be a depletion of testosterone levels, and you can be tested for that and seek some help and advice from your GP. Next slide. Now, emotional and mental health is almost invariably affected during the diagnosis and treatment for any cancer. We're very keen to encourage our patients to engage with our psychologist to have a discussion of how the different strategies that might be helpful in coping with some of the common symptoms like difficulty sleeping, poor concentration, or feeling down or feeling worried. In terms of these symptoms being present after you've finished treatment, we have some resources in our hospital that we find are very useful. We refer our patients to a survivorship clinic, and they can have contact with the psychologist at that point. But for hospitals that don't have a survivorship clinic, you can certainly speak with your GP about being referred to a psychologist, and there are some Medicare rebates for a certain number of sessions per year. Now, for some people, they may not feel the need to have a referral to a psychologist, but certainly reaching out to patient support organisations like Lymphoma Australia to attend information seminars can arm you with information and also then reassurance about where you're sitting in your lymphoma journey, and may allow you to talk with other people who've had similar experiences. And the really foundations of good mental health are to focus on getting good sleep, nutrition, and exercise. Next page. So, look, in terms of what the research tells us about the long-term health of Hodgkin lymphoma patients, we know that unfortunately after finishing Hodgkin lymphoma treatment, there is an increased risk of developing a cancer later on in life. And this was a research paper that was published now 10 years ago and studied nearly 4,000 patients in the Netherlands. And they found that their risk was about 4.6 times the general population of developing a cancer later on. And other studies have had similar findings. And with this, we're really armed to try to screen for and identify the common cancers in our lymphoma patients so that we can allow early diagnosis and treatment. Next slide. The research, and the next slide as well, thank you. The research also tells us that there is a higher chance of longer-term heart disease. And next slide, please. And again, from these two studies are the most recently published information. And so from 9 years ago, a study of younger patients that had been treated for Hodgkin lymphoma found that there was about twice the burden of chronic heart disease conditions as they reached adulthood, and nearly 5 times the number of more severe heart presentations. Next slide. And next slide. So we know that there are potential, not inevitable, but potential health issues that can arise after treatment for Hodgkin lymphoma. And what can we do? I don't tell you this to create more worry, but what I'd like to arm you with is the information and the awareness so that we can put in the principles of early detection of cancers and heart problems through regular checkups, engage in preventative health through a healthy lifestyle, and make you really well educated about some of the symptoms to be aware of, and also help you educate the other healthcare workers around you, doctors and nurses who may not have this specialist information about the things that can happen after your lymphoma treatment. Next slide. So this is a broad schema of what I think should happen in the follow-ups after Hodgkin lymphoma treatment. The first 3 years of follow-up are focused on your specialist checking for lymphoma returning, and that is usually an appointment with your hematologist or oncologist every 3 months. In the next 2 years, so 3 to 5 years after finishing treatment, the likelihood of lymphoma returning actually decreases, and the focus changes to follow-ups for some of the side effects of treatment that we've spoken about. It also changes to ensuring that you're fully immunised to prevent against infection, and that you're re-engaging with your GP to enrol in the cancer screening programs that we have nationally in Australia according to your age and your gender, and that you're maintaining your psychosocial well-being. Have you been able to return to your work or carer functions? And in general, how are you doing psychologically and reintegrating back into your life? That's usually within a review every 6 months. It can be with your original treating hematologist or oncologist, or through a survivorship clinic if there's one in your area, or through your GP. At the end of the 5 years, we would consider you cured from the Hodgkin lymphoma if it hasn't returned. And at that time, your ongoing checkups will be generally recommended to be yearly, and they can certainly be done at that point with your GP. And it's very much around making sure you're fully immunised and vaccinated for the common infections, and largely that's around seasonal influenza, and also that you're being monitored for late side effects. Let's go on to the next slide. Post-chemotherapy follow-up should include a yearly full blood count to check on the levels of red cells, white cells and platelets, immunisations, as I've touched on, and for patients who've received the 2 common chemotherapies, consideration about maintaining your heart health. So thinking about symptoms of heart disease at the end of treatment, and if you were evaluated as having any heart conditions at the end of treatment by your hematologist, having an ongoing assessment by your cardiologist, avoiding smoking and excess alcohol to maintain a healthy heart, and thinking about the other things that keep our heart healthy: lowering blood sugar, cholesterol, keeping a healthy body weight and blood pressure. Next slide. The cancer screening in Australia, it depends on your age and your sex, as I said, but as most of us know, includes programs for pap smears, mammograms, prostate evaluation, bowel cancer checks after the age of 50, and there's now a national lung cancer screening program for people who've had a smoking history. In the Australian climate, I also really strongly think it should include an annual skin check. Next slide. Specifically after radiotherapy, if the radiotherapy was to your neck, we would check your thyroid function every year and consider an ultrasound for 5 years afterwards to look for any thyroid nodules. Radiotherapy to the breasts. This is an important area for follow-up. There are some guidelines of when to start screening for breast cancer after radiotherapy to breasts, and the screening should start approximately 8 to 10 years after you've finished radiation. If you were an adult when you had your radiotherapy, then that can start at age 40. Or 8 to 10 years after radiation, whichever comes first. Slightly different criteria if radiotherapy was received when you were a child. In terms of what tests, I think this is something where I'd really like to, spread the word that in addition to the usual mammograms that we're familiar with in for breast cancer screening, it is recommended that breast MRI is used in the follow-up after radiotherapy to the breast area. And that's, I think that's for two reasons. One is that it can detect early cancers slightly earlier. And secondly, that a lot of Hodgkin patients are young when they finish their radiotherapy, and therefore they have that more dense breast tissue where MRI can pick up cancers sometimes a bit better than mammograms. If radiotherapy is being delivered to the heart, the cardiac or the heart area, then your specialist should have referred you to a cardiologist specialist for follow-up for the possible side effects on the heart. Next slide. Now, this is quite a lot to take in and remember. And so even as a doctor sitting in clinic, I find that this is a lot to get through. And so that's why at some hospitals we've got survivorship clinics where time can be taken to identify, educate our patients, and use a big multidisciplinary team, a doctor, nurse, exercise specialist, dietitian and psychologist to take you through all these elements of follow-up. Now, not all hospitals have a survivorship clinic, so we want to make this information about the follow-up available so that many of these tests can actually be done in the GP setting. It's just a matter of having an idea of what should be done. And that information's, we can share some really good resources about that information. Next slide. That essentially the Lymphoma Australia have some good information on that. Now, I've hinted that we still can have a lot of improvements that we would like to make for Hodgkin lymphoma treatment. We want to use these targeted therapies so that we can use less chemotherapy and less radiotherapy. And we have to do that through clinical trials. We have to prove that the new therapies are going to be as safe and effective. And there are ways that you as a patient can find out what clinical trials are available. And there are two websites. One is called clintrialrefer.org.au and the other is the Australian, New Zealand and Clinical Trials Registry. And it is very much something I'd encourage you to gently prod your specialist if clinical trials haven't been discussed and say, is there a clinical trial that might be suitable for me? Certainly a question that good specialists will not mind hearing asked at all. Next slide. So thank you for listening to that first part of the talk. What I want to share with you now is this really exciting research project that we have where what we'd like to do in this research project is take all of those side effects that our patients experience and try to understand them better directly from our patients. The way we find out information about any disorder is through research, and traditionally, to do any research on any cancer, we would ask patients to come into the hospital and we would perform tests on our patients, and through doing that we've found out a lot of information. But unfortunately, with that really traditional research model, we've missed doing the research on people that can't make it into a big hospital centre. And as doctors and researchers, we haven't always taken the time to ask the questions that might be most important to patients. For example, why am I still feeling fatigued? What should I be doing about my concern about heart issues? Or how common is it that I'm having problems with fertility, and is there, are there some better answers for me? These are some of the questions that we know are relatively unanswered in Hodgkin lymphoma and other blood diseases. And this is what we would like to answer with MyHodgkin MyHealth. So, next slide, please. what we're inviting all of our Hodgkin lymphoma patients to do, I've sort of skipped through this, is to join with us in the MyHodgkin MyHealth research app. Just go to the next slide, thanks. And instead of asking patients to come in and join our research in a hospital, we've designed a mobile app that you can download onto your own phone and answer some questions about your lymphoma and any of the side effects that you may or may not have experienced after treatment. And you can do that on your phone through a secure app that we've designed with a developer here at Concord Hospital that's passed through some really rigorous data security checks and has been approved by the ethics committee at Concord Hospital. We want to know what treatments our patients in Australia have had. We would love to hear from people that haven't had side effects, plus people that have had side effects. And we want to map how your health is now and also into the future. One thing we know from Hodgkin lymphoma research is that there are some side effects that can still develop that are related to the Hodgkin lymphoma treatment, and that they can still pop up 10, 15 or 20 years down the track. We'd like our patients to join with us on an extended research journey and tell us about your health over a long period of time. You'll become our partners in research. You'll be able to give us feedback if there are questions that you think we should be asking that we're not asking. And by telling us about your health through the questions in our research app, you'll understand what some of those possible side effects of treatment are. As you get taken through the app, there are sections on heart health, lung health, nerve health, and hormone health. And for a lot of our patients that have gone through that app, they've actually understood that they do need to be aware of heart symptoms and lung symptoms and hormonal symptoms, and they felt that that's actually been a really empowering thing to be better educated about their own health. So far, if you go to the next slide, we're focusing on these heart, lung, immune system, nervous system, and fertility side effects after treatment. And we've worked with our Hodgkin lymphoma patients at Concord Hospital to develop the questions, and so that it is very user friendly. And next slide, please. And we're developing more questionnaires that are going to focus on tracking the quality of life of our patients and thinking about other effects of Hodgkin lymphoma treatment, like the impact of the treatment on employment and education opportunities. We would love to dive even deeper into reproductive health issues and the health consequences of early menopause, because these are areas that haven't been well studied before. Next slide. So yesterday we presented this at an International Women's Day event, and I was able to tell everyone in the room that we'd had 70 participants. And last night I was updating this slide and I was absolutely overwhelmed to see that we had 113 registrants as of last night. So the numbers are just skyrocketing. And I think Professor Trotman, who was the founder of this project, told me just an hour ago that we were up to 139. I know that's due to a lot of you who are on the call now, and I can only imagine that that your responses have been similar to our own patients who we've been developing the app with, who've said that they are so excited that there are researchers that want to know what's happening to their health after they've finished treatment. We know that when you finish treatment, a lot of the contact with us at the hospitals drops off. And I think we've heard from patients that you would like to tell researchers how you are feeling so that we can help to improve treatments for you and for others in the future. So we want to get to 200 participants by next week. We want to get to 1,000 by the end of the year, and then we want to go global. We want to find out this information from Hodgkin lymphoma survivors all over the world, who live in all sorts of different countries with different health resources, and then we can really start to, I think, have an impact on some of the newer treatments that are coming up. And how are we going to do that? Well, we'll be able to tell our, and as researchers ourselves, we'll be able to understand what are the long-term side effects of certain treatments, and we'll be able to map the long-term side effects of some of the newer treatments. We can take that information back to our government and other funders and explain some of the benefits of the newer treatments, and really try to argue for using some of these newer treatments earlier and earlier in the treatment of Hodgkin lymphoma. So we do think that this research can make a real difference to the lives of people with Hodgkin lymphoma. And you can see we presented the research project in the International Symposium of Hodgkin Lymphoma in Germany in October last year, and other researchers were really excited that we'd come this far with the project. And none of the other international researchers have really delved into this. So really, I think as an Australian innovation, this is really leading the way. So we're really, really very proud of this, and very proud that a lot of you have already signed on. So I'm going to stop there and encourage you to ask any questions.
Thank you so much, Nicole. Judith has got her hand raised, so jump in. Oh, we can't hear you, Judith. Do you want to
Can you hear me now?
Oh yeah, that's great.
Sorry, I'm really quite happy to wait till everyone's asked their questions of Nicole, but perhaps while they're thinking about their questions, I just want to acknowledge the years of work that Nicole has spent, yes, along with the rest of us, but particularly Nicole, in getting this app, bringing it to fruition. It is such an exciting time for us, and I've got to say we were completely bowled over by your efforts, Nicole, at Lymphoma Australia. It's spruiking the recruitment and the downloads of the app. It's a clear example of patient power and how this is very much a patient-led research partnership. Can I just make, and hopefully those who've, after general questions about Hodgkin lymphoma survivorship care, if anyone has already downloaded the app and used the app, could give us their questions and feedback. But can I just make an extra plug on behalf of Nicole? Because we know that if we get 200 participants by the time she drafts her abstract for the International Lymphoma meeting, that it will make a huge impact on our international colleagues. They've been really excited about this app, and the proof in the pudding that it will work is really dependent on Australian participation. So we want 200 by, I think it was 8 o'clock Saturday night, wasn't it, Nicole? We said we wanted for the abstract writing, and we're hoping then we'll smash out many more hundreds by the time the June meeting comes around to present to our colleagues. And just one more comment about the app, as Nicole has already said, it's a platform. It's just the start. And while we focus on the chemo you've had and your survivorship, and the cardiac side effects, the neuropathy, we're really looking forward to digging more into the issues around fatigue and return to exercise tolerance and mental health impacts and the learning and earning impacts and other quality of life, health related quality of life issues once we've had proof of principle. So that was a very long-winded way of saying, please, please pay it forward and and download the app. And anyone who's registered, you can consent yourself, read the information, consent yourself online, and then once you're a participant, you will be recipient of the data, of the published results as it comes out hot off the press.
Thanks, Judith.
Yeah, thanks so much, Judith.
I've just opened up the Q&A, Nicole, and
Yeah.
I'm happy to go through some of these that are still open.
Yeah, sure. There's
if
one
that's-
person, just one of the attendees has just got their hand raised as well.
Great.
So Janine, I think it is, that's got her hand raised. We'll just let her ask one question, and then we'll go through the questions in the Q&A.
Hi, can you just go through what the inside of the app looks like? I'm a nurse. I'm just trying to, I have patients in mind to add, but I wasn't sure how I can explain it to the patient, what it looks like inside of the
Absolutely.
content.
And I'm delighted to, Jean. And we've also got a testing version of the app for any health professionals that want to actually look through it themselves. You've done the right thing. Yeah, please don't register as a patient, otherwise your data goes into our research database, but we can send you a testing version. So this is a research app. So there's no information that's collected from our patients when they download the app. They'll download it from their app store, and then they'll be given some information to read about the project, and they'll be asked to sign a consent form. They'll be told how their data is going to be stored securely and also anonymously. And then we're asking patients to give us their name, their treatment location, and some information about their lymphoma, when it was diagnosed, and what treatments they've had. We've tried to use as plain language as possible, and the patients that have helped us design that have made sure we try to cut out too much medical jargon. So then we're asking our patients to tell us if they've needed any second or third treatment, and to enter that. And then we take them through a series of about 6 different chapters of questionnaires, asking them about whether they've had any issues with heart problems and some specific questions about that, any issues with lung problems, any issues with thyroid problems, or any neuropathy symptoms. And also some questions about whether they've tried to conceive after having their Hodgkin lymphoma, so that we can collect some information on fertility. Depending on the person, how complex their treatment has been, our patients are telling us it may take them about 20 minutes. You don't have to complete the questionnaire in one sitting. It will save. You're able to save it as you go. And a lot of patients have said they couldn't quite remember some details of their questions, and there are guidances to encourage them to go and ask their doctor to clarify an aspect of their treatment, and they can come back and update that in the app later on. There's an email address, which is very easy. It's info@myhodgkinmyhealth.com, and they can email our team for any questions. That email is literally monitored by myself, one of our project teams, and so you'll get through to us. We're a pretty small outfit at the moment. I hope that answers your question.
Okay, thank you for that question, Janine. So we've got a few questions in the Q&A. If anyone else wants to ask anything, please pop it in the Q&A. So I'll just start with the first one. So this is from Joe. How do you know that Hodgkin's lymphoma is fast growing? I suspect I have Hodgkin's lymphoma for 5 years before I was diagnosed, and I have met others who believe they had it for 10 years prior to diagnosis. In this example, the gentleman had a bad cough for 10 years before the Hodgkin's lymphoma in his chest was discovered.
That's a great question. In many people, Hodgkin lymphoma is not fast growing, And when you do delve into their history, for many people, they in retrospect had symptoms for a period of time. So whether that's maybe, you know, a year of symptoms or over a year of symptoms, it's certainly something we do see. It's not the case in everyone. So for some people with Hodgkin lymphoma, the growth is slightly quicker. So it is quite individual. And the other thing is that sometimes Hodgkin lymphoma will start off in an area of the body that where the initial symptoms are very subtle. So if it is in the center of the chest, often it doesn't cause symptoms that are very clear. You know, it causes very mild symptoms until that lymphoma grows to a certain size. But in retrospect, you can say, yes, I think that cough was probably been there for a while, and that lymphoma growth can be quite slow. So I think that's a good observation.
All right, so just got a second question. So this one is, what do you suggest people do if they come across health professionals who dismiss their concerns?
Yeah, look, I mean, it always worries me when I hear that. I think that I think it depends on the timing of when that is happening. So at the outset, at diagnosis, I think it's really helpful and important to take a support person if you have one, so that someone can help you to really reiterate your concerns with your doctor. And where there is time, I think it's as a hematologist, I'm very open to my patients asking if they can hear a second opinion, and I think that is an option. If it's really during or at the end of treatment, and you think that there are symptoms or side effects that you're not that are not being taken seriously, I do think that for Hodgkin, for any lymphoma, we do work in a team. So I do think asking the question again to a different team member is one thing that you can do. You may be being seen by a team that consists of people with different levels of experience. And so please be persistent if that symptom or that problem is really important to you. It is okay to ask that and encouraged to ask that question a few times, because we do work in teams and we all have different levels of experience. If you're outside of the hospital system and you think, gosh, I'm not sure that this person really knows as much about lymphoma as perhaps you have acquired, then I think that's where, you know, getting some information from a trusted source like Lymphoma Australia, or there are other good patient support organisations, and taking that information to a doctor, whether it's your GP or maybe it's another specialist down the track who may not know as much about lymphoma, and say, hey, look, you know, I know you may not see many patients with lymphoma, but these are some of the things that you know, lymphoma patients can experience, and it may be helpful to take that the information from a trusted resource as you have other interactions with other doctors. So I hope that they are some tips that can help. Yeah.
Thank you. Okay, next question. Hold on a sec. It just moved. There we go. Clinical trials using medications, for example, tamoxifen, are being offered to young women who have a strong family history of breast cancer or have BRCA genes to prevent the development of breast cancer. Is anyone offering these types of clinical trials to young women who have been exposed to radiotherapy or adriamycin? And the other name for adriamycin is doxorubicin.
Look, there aren't any trials that I know of that are looking at preventative treatment for women who are at high risk of breast cancer after radiotherapy or chemotherapy. the programs, we work really closely with other breast specialists and breast surgeons to make sure that the follow-up of breast cancer, especially if you're at high risk because of family history, to make sure that the follow-up is, is in line with the up-to-date information about breast cancer. I'm not a breast cancer specialist, so if I see a patient of mine who has particularly high risk for breast cancer after finishing their lymphoma treatment, then I'd be inclined to actually refer them to a breast cancer specialist to make sure they're getting the most up-to-date information. But no, I'm not aware of those clinical trials, but yeah, I think we've got to work with other doctors who are real specialists in their area.
Okay. Next question. Is it essential to clear exercise with a specialist after ABVD and BIACOP, or is it generally safe to do what feels good?
I think in probably 90% of cases or 80% of patients, they're probably not seen by an exercise specialist to clear them for treatment. And in terms of your lymphoma specialist clearing you for treatment, they may not give a black and white, okay, cleared for exercise. And in general, what feels right is appropriate. So a gradual return to exercise is appropriate. I try and say that explicitly. I try and say that really clearly to my patients so that they know what's safe. That is, just build up gradually. But by and large, it is fairly common sense. Yeah.
Okay. Just got another question from Joe. So my second question is, has any progress been made on discovering the cause of Hodgkin's lymphoma?
That's a great question. I was involved in some research groups earlier and during my PhD who were in groups who were looking at this, and there are a number of triggers. So which is a term we use when we can't identify something as a definite cause. There are some triggers for Hodgkin lymphoma, but those triggers are not present in every patient. And so we know that for a small number of patients, a virus infection and an Epstein-Barr virus infection can be a trigger for Hodgkin lymphoma. It's not enough to be a cause for Hodgkin lymphoma, and it's only a trigger in a small proportion of patients. But that gives us a clue that Hodgkin lymphoma probably arises from an interaction between your immune system and another trigger that's coming from the environment. But unfortunately, we don't know what exactly that trigger is in each case.
Okay. So Jasmine has a question. I'm 43 and was put on Zoladex through escalated BIACOP DAC treatment. What do you know about this helping prevent early menopause? I've read some patients take over 6 months for period to return. Is this what you find also?
Yeah, so the use of Zoladex is an area where we would say there's not enough really strong and high quality evidence for us to clearly say whether it helps protect fertility significantly. It may have a mild protective effect, but the research done so far is still in that sort of uncertain level. So in our experience, some of our fertility specialists will recommend it, but others really assess that so far the research shows that the protective effect is still uncertain or pretty mild. Your second question is a little easier for me to answer. It can take a good, minimum of 3 and yes, up to 6 months for periods to return. our gynecology colleagues can use some hormonal testing to predict whether, to what degree your fertility's been affected. And generally, a once-off test is not quite enough. They would like to follow you over a period of time to see whether there's some recovery of that ovarian function. But I do have patients that have got that have had symptoms where we weren't sure whether they were early menopause symptoms. The periods were still there, but they weren't the same as before treatment. And so I sent them to a gynecologist to interpret those hormonal tests and to try and really give that patient a sense of why they were getting these symptoms, to consider hormonal replacement therapy. And also to just say, well, to help them move on and say, well, I'm okay if I've got postmenopausal symptoms. I just want to know why I'm feeling the way I'm feeling. So, yeah.
Yeah, excellent. So next question, I guess this is more directed at the lymphoma nurses. Is there a non-Hodgkin's lymphoma section available in the near future? Absolutely. Keep checking your email, keep checking Facebook updates. We are doing lots of webinars, and we will be presenting them pretty much every month to 2 months. There's something going on. But if you're talking about apps, I'm not too sure about that at the moment. We've just got the MyHodgkin's MyHealth app. So next question is from Robin. I got really excited about the app, but didn't read properly. Whilst I'm longer term, I haven't finished my journey. I am still on Pembro at the moment. Originally diagnosed in 2005, ABVD and radiation. Recurrence in late 2023, GDP and radiation. Failed the GDP in September 24. I started Pembro and am still on it. Main issues, neuropathy and joint pain, endometrial cancer, and triple negative breast cancer in the process. I have filled in data, but then wasn't able to fill in I am still going. After all that, do you need to remove my data? Do I deregister?
Oh,
Nicole.
Robin, no, definitely don't re-deregister. We can use all of your data. And in fact, I may have been a bit misleading. We really, for people that are still going on their first Hodgkin lymphoma treatment, that may be a little early for them to complete the survey. You can, for your case, Robin, you've done, you absolutely can stay registered and you can complete the survey. Yes, you're still going in your Hodgkin lymphoma journey, and we want to now keep following you and find out what happens in your next chapter. If you are still just going through your first Hodgkin lymphoma treatment, you can actually start the process. And when you've finished your first Hodgkin lymphoma treatment, you can then complete the survey when you've finished. But it's quite okay to get in there early and start filling it out. We're delighted with that.
Judith has her hand up. Please add.
Yeah, could I make an extra comment to Robin? Because I think I heard she said that she was first diagnosed in 2005 and then had quite a late relapse. Which I think, is that right?
That's correct. Yeah.
Common. And
yeah.
This is exactly, Robin, your story is exactly the sort of story. We want the cures, but we also want the long-term stories captured in this app, because on the traditional clinical trials with 5 years follow-up, Robin, you would have been cured and no one would have known about your breast cancer and all the other challenges you had in the relapse. And this is exactly why we want long-term follow-up. So this app is fine for anyone who's just halfway through their initial ABVD or escalated BRCOP, and it's also fine for someone who's had Hodgkin's 30 years ago. And it also doesn't matter if you can't remember everything, or you've even got some of the data a little bit wrong. There's a means by which once you get to the end of the app, you can create a PDF that then you can print out and take along to your treating team and say, look, I think I had 3 cycles of ABVD and then some radiotherapy, but I couldn't quite remember. And I think it was in 2010, but it wasn't May 2010, was it November? I'm not sure. Can you just help me and just make sure I've got the data right? And then you can go back and correct it. Because ultimately, when we have thousands of patients on the app, minor errors in an individual patient's data is not going to matter, especially when you will go and update it. So don't be frightened. But thanks, Robin, for doing and putting so much data into the app. And, people like you who have had so many different challenges, we really want you to really test the app and give us, detailed feedback, please, when you have the opportunity, so that we can improve the app, because it's a constant improving exercise. So we really want you all to break the app in some ways, so that we can make it better for when we go global. And there's also an option at the end. Once you've completed your survey, you'll get a little pop-up saying thank you, and there's a link by which you can share the app with other Hodgkin lymphoma patients. And we're hoping every single patient will recruit another patient who they may have known about when they're in their own journey. Thanks, Nicole and Nicole.
Thank you, Judith. We've got another question from Alice. So it would be interesting to add an area to the survey for suggestions for improving patient welfare during treatment. For example, I find it shocking that many patients aren't offered a port in the public system when many chemotherapy drugs actively damage veins. Is this a cost concern?
So I'll just answer the first part of your comment about thinking about access to treatment, and yes, that's a question that we want to answer both within Australia and also globally. There are some studies that that suggest that for certain cancers, the socioeconomic level of the area that they live in, or for instance their distance geographically, and perhaps they live in a regional or remote area and their distance to a big city hospital, that can sometimes affect their outcomes in other blood cancers. So broadly, we would like to look at that. It will be more challenging for us to look at some of the really detailed things, like about whether specific treatments and supports are available within a system, but I like the access to a port. But I think you raise a very good question that we are interested in as well, which is equity of access and equity of delivery of care.
Yeah. So next question is from T. Is it possible that pregnancy can be one of the triggers?
Well, we have a number of patients that are diagnosed with their Hodgkin lymphoma during pregnancy. And gosh, I can't imagine a more difficult thing. When we look at the population of Hodgkin lymphoma patients in really large numbers and globally, it doesn't appear that pregnancy is a trigger. It doesn't appear that pregnancy is a time when Hodgkin lymphoma particularly appears. We do obviously really, really remember those cases because they are really challenging for the patient, but it doesn't seem to be one of the things that stands out as a trigger.
Judith's got a hand up again. Did you want to add anything to that, Judith?
Sorry, lowering hand. That's a legacy hand. Sorry.
That's okay.
I think there was also another hidden question in the port question about whether we health information. And yes, we are. I mean, I don't want to say the sky's the limit, but there are so many things that we can iteratively do if we make this app a success. So that, for example, when we ask the fertility questions, we have a link to your Lymphoma Australia fertility links on your website.
Mm.
There are little things that we can give people to help improve their health literacy on the way. And I know Nicole's very keen to do that. But, you know, it's pretty much a shoestring budget for this app. So we've sort of just got to get proof of principle first and demonstrate that there is real interest and support for it before we can start layering on other things. And the other thing we don't want to do is overload people with too much time. Once they've done the app first, we expect every 6 months they'll be in and out, hopefully within a couple of seconds, you know, just the press of a button if there's been no updates in their health status.
Yeah, thanks, Judith. Janine's just got her hand up again if you'd like to have some input.
I think I just wanted to comment on the port access. I find that it's most of the time it's a timeliness of getting the port inserted. If anything, if there is a need for a central venous device, it's likely be a PICC line, as it is a lot faster when we want patient to start treatment right away.
Yeah, absolutely. I have the same experience as well. Thanks, Janine. And looks like we've just got one last question. My husband had non-Hodgkin's lymphoma at the same time as Hodgkin. Should he include this information?
Yes, please. We hope that the way we've designed it, your husband could include that in the section on other cancers. And we've left that as open as possible so that, yes, I think he should be able to enter that.
Excellent. Well, that concludes our webinar tonight, unless anyone has any other pressing quick questions that they wanted to ask. No, just raise your hand or pop it in the question and answer section. But if not, thank you all for attending the webinar this evening. And we really appreciate your time and hope that you have been able to increase your knowledge surrounding Hodgkin lymphoma. If you have been diagnosed with Hodgkin's lymphoma, we would really love your help in downloading and registering for the MyHodgkin MyHealth app before 8 p.m. on Saturday. So if you're having any issues with the app, you can also email info@myhodgkin.com. And if you have any questions regarding your lymphoma diagnosis, treatment, or you just need more information or you want to talk to a lymphoma nurse, please reach out to us. We're here Monday to Friday, 8:30 to 4:30, nurse@lymphoma.org.au or 1-800-953-081. You can find that email, that phone number all over our website. So we'd love to see you again in our upcoming online or in-person support groups, our future webinars or events. So just keep an eye out on your emails. And we've also got the events calendar that's on our website as well. So you can always check the events calendar just to see what we're doing. There's pretty much something going on just about every 2 weeks. There's either support group, a webinar like this one on different subtypes. And we also have patient educational. Some events are going to be in person as well. So just keep checking socials, emails. You'll see them there. So that concludes it, but we have one more hand up. So one more question. So that's from Moxina. Hold on. Did you want to ask a question? Just got to unmute yourself. There you are. Yep, you can speak now. Oh, we can't hear you. No, it's not working for some reason. You could type the question if you like, Moxina. Not working for some particular reason. If you want to email us or give us a call tomorrow, you know the number. If you didn't get it from when I was saying it, just check the lymphoma.org.au website and we'll hear from you then. Okay, everyone. Thank you so much for joining us. Thank you.
Thanks,
Bye-bye.
everyone. Thank you.
Bye-bye.